podcast. Is there further comments?
Hi, this is Dr. Mark Sehl from the YouTube channel Therapy for the Heart, and this is talk 72. We're going to continue with the talk that was done on the podcast, and that was episode 8. We have a podcast that's also playing along with a complementary to the YouTube videos. So the content is often very similar, but it's just podcast versus YouTube videos. So that was podcast number 8, What Stops You? And that refers to what stops you from engaging in therapy. So we're going to further continue that subject, what stops you. So Donald is really an expert in working with the resistance, and sometimes I think he has a feeling that people perceive us as not doing too much sometimes in therapy, above and beyond listening and maybe making a comment here or there. And of course, it's more than that. But he wants to inform all of us and share some of the examples of what he does in terms of working with what stops people from getting into therapy.
Yes, I mean, even in our last couple of talks, I kind of felt we gave the impression that we listen, we allow the person to find their own way, to talk, not to talk, as they need to, and that we're kind of passive, that we engage when we have something to say, but for the most part, we're on the passive side. And that is true for some patients. On the other hand, in your podcast, you were talking about some of what we call initial resistances, which can really stop a person from going into therapy. Or, let's put it this way, if we don't engage them in trying to deal with these unconscious forces that are inhibiting them from seeking help, the therapy will be unsuccessful because they will leave. It's as simple as that. So, with those patients, sitting there and listening and not engaging them is absolutely in the wrong direction. Those patients are going to ultimately leave and not come back, which will make their life that much more difficult. It'll be one more failure. Let me give you some examples of what I'm talking about. You gave an example of someone on the phone asking about what the fee is, and then using that to say, oh no, it's too expensive, and then going, not coming in.
Right. That was along the lines of why it's not good to say what your fee is over the phone.
Yeah.
However, when many therapists will do that, and then the prospective patient will find that whatever you're going to say about the fee, whether it's $25 or $125, they're going to find, oh no.
Oh no.
Whatever. Yeah.
Right. So, I mean, what I say, for example, often say when someone tries to engage me in that kind of a conversation is that before we talk about fees and money, let me see if I can first help. Let's sit down and talk and see if I can help. And then we'll talk about...
That's after they get into the office. Right.
No, on the phone.
They could read on the phone.
On the phone. They said to me, and what is your fee? I'll tell them, hey, before we talk about money, let me see if I can even help you.
Okay, good.
Then we could, if I feel I can really be of some help, then we could talk about money.
Right.
At least that does not give the person a chance to use the money as something to say, oh no, it's too expensive, I'm out of here.
And so if they say something like, well, I really have to know the fee in terms of whether I'm going to be able to afford this on any kind of ongoing basis.
Well, I'm not trying to make your life more difficult. That's not why I can't respond to that. But before I can even discuss money with you, let me see if I can be of some help. Mm-hmm. There's no point in talking about money if, in fact, I can't help you. Let's sit down and talk. and then we'll see if I feel I can help. Then we can discuss, what's doable and what's workable for you.
How are you going to know if you can help me?
We talk. Let's talk. We can't do this on the phone right now, but let's set up a time and we can talk. And that's basically, a way of kind of come to terms with that underlying resistance of closing the door before you even start.
Right.
But there are many other ways. There are many ways of dealing with this kind of initial resistances. That's a technical term for it. I've had the experience, and you probably did too, in some ways, of a person coming in and saying something like, and this refers back to the old joke by the Marx Brothers. I wouldn't belong to a club that would have me as a member. And even though they're there, which is again that sign of health, they could say to me, and they have said to me, I pay you for caring. I give you you give me 45 minutes, and I give you money, and once I walk out the door, out of sight, out of mind, you don't care. You don't care. You're like a prostitute. You care because I give you money when I'm here. When I'm not here, I don't matter. Now that says something to me about what this person's experience has been, but if they really feel I don't care, that person's going to be gone. They're going to be gone, whether it's one session or they're going to come back at all. So you have to engage them at that level with that issue. Sometimes, patients come in because they're coerced to come in. For example, a husband or a wife comes in, or not even, could be a significant other, don't have to be married even, saying that my significant other said to me, unless I get some help for this issue, they're leaving, they're going to see an attorney, they're married, they're going to get legal separation, their family's going to break up if they have children. So they come in for the consultation. They're resentful because they're being coerced to come in. They don't necessarily want to come in. They feel they have no choice. Also, not exactly a good way to begin therapy. And unless you engage with them in some way about their resentfulness, how it comes to pass, that they want to keep this relationship, but somehow it keeps getting into trouble, unless we can engage them and try to make that a common ideal that we're both striving to work toward, they're going to be gone. They will come in, and they may come in for a session or two, and then they'll be gone. How do I know this? Because I've learned.
The hard way.
The hard way, right. You learn. That's one of the difficulties about working with patients who are coming from courts, who are mandated to come in, and where you have to report to the court. Very difficult. Really difficult to engage that person. Why? Because they're being coerced. Everything that they are saying will be held against them in a court of law. It feels like a setup, a trap, where they're going to wind up ultimately being blamed and hurt. So why would they want to do this? They have to do this. So there are all kinds of issues that come up that make us sitting there being quiet absolutely the wrong thing to do. And we have to know from experience, from training, how to engage these kinds of issues actively. We have to really get active working with this person to try to help them come to terms with what's going on in their life.
Which
And
is
if-
mostly unconscious. to them.
Yeah, it's all unconscious. You know, the person who comes in saying, you know, I'm here because my girlfriend, my wife, for example, you know, I go out drinking with the guys. I pick up women in the bars. We have innocuous sex. It means absolutely nothing to me. I never tell that to my wife, but I come home and and she smells it on me. She knows what goes on. I told her it means absolutely nothing. She feels betrayed. She's angry with me. I love her. I love my 2 kids. I want to have a family. You know, she's going to leave me if I keep this up. She told me unless I get some help. But I resent being here, so I'm being pushed to be here. The person that says, you know, I'm addicted to, or I'm watching a lot of porn on the internet. My wife feels betrayed that I'm paying money to have women I talk to women on the internet, telling them what to do, and while they're doing it, I can masturbate, and I enjoy that. My wife feels personally insulted by this, that I'm not satisfying her, that she feels betrayed, as she felt betrayed by a previous boyfriend, that she's not going to put up with this stuff. I love my wife. I love my kid. I don't want this to be a broken family. I can't afford to have a second apartment. I don't want that to happen, but here I am. You know, unless you can engage that person, they're going to be gone. So sometimes our work is not as simple as it may sound. And it's not simple. Not by a long shot. It is not simple. And we have talked about this before. I've often said that I am really, that I am amazed sometimes at somebody who's had repeated failures or repeated difficulties in some issue in their life that's repeated on and over again, still has the courage to come in to want to deal with it. And that's true. But that doesn't mean that the person who's being coerced coming in to deal with an issue is really very actively going to want to work with you so that they can help themselves. They're there because they're being pushed to be there. And unless we can help that person by having them see something the way we see something, see it through our eyes, and we can work on together so they can have the kind of relationship that they want without getting into trouble, without causing all these conflicts. Unless we can somehow establish that person is going to be gone. And they'll repeat, their marriage is going to fail, the girlfriend's going to leave, or whatever. It's not going to happen.
So in some way their intention may be not to really get help.
In some way, right, they don't deserve it. These people really don't care about me. I shouldn't have this kind of relationship. I'm not good enough for this. Whatever the issue is, it's going to repeat. The failure is going to repeat. They're going to be hurt again and again and again. This is a chance for them to come to terms with it, although part of them is trying very hard to undermine themselves by demeaning you or me, that we're just prostitutes, for example. We couldn't care. Why should we care? Once they walk out the door, they're not paying for us anymore. As if they're paying money for us to care about them.
Yeah, just out of sight, out of mind.
Right.
You're not going to think about them once
Why
they
would they think
leave the
about
premises.
you? They're not. We're thinking about them. I mean, that's all implicit in what they're saying.
Implicit, but not
Implicit,
explicit.
not
Yeah,
explicit.
not at all.
Implicit,
Yeah,
right.
yeah.
And, the fact is that they're not paying for our care. They're not paying for care. there's no amount of money that we could charge that would compensate us for caring. We hear some of the most painful things that people go through in their lives all day. I mean, how do you translate that into dollars and cents? I mean, there's no amount of money that can compensate us for this. So they're not paying for our care. What they're paying for is our training and experience.
Well, and in one way, though, what they're doing also is not paying for our care, but that's what they're going to get from us in some way too.
Right.
Is feeling cared for by
which they can't tolerate right now.
Right now, but
Mhm.
ultimately, we don't want to forget that one of the things that we do provide is through listening and paying attention is something that they never often have received in their life.
Right.
Yeah. So it's
That's-
really that's a kind of caring that, not the kind of caring that they're talking about, but that's the kind of caring that people will hopefully assimilate and see that somebody else is interested in.
Mhm.
But here you're talking about somebody who doesn't, nowhere near that.
Nowhere near that.
Yeah. So you're
Yeah.
talking. So what would you do with this person who is saying that he's watching porno and he repeats that with his wife, even though he knows that she doesn't like it?
I try to help that person understand. Take a look at the conflict that he's having, for example. If he knows that when he's out with his friends, drinking and maybe having a relationship with a bar with a woman, a one-night stand, a couple of hours in bed, and then coming home loaded and smelling of sex with lipstick on his collar, that kind of stuff, but it means nothing to him. But he does it over and over again, and yet he values his relationship with his wife, and he values relationship with his child, and he doesn't want to break it up.
It sounds like a contradiction.
It's a massive contradiction, and I try to get that person to recognize the contradiction. I mean, what is going on? What is going on?
That's a question that you would ask
Yes,
that person.
that I verbalize.
At what point, though?
Sometimes the initial consultation.
Yeah. At what point in the consultation would it be? Sometimes when he reveals that he does these things, even though he knows he doesn't like them, or she wants to divorce him because of it, even though he knows that.
Yeah.
Would you suggest that contradiction to him?
Yes.
So
Yes.
that would one be try to help him bring some awareness of this kind of conflict that he has about wanting help, but also provoking the very thing that he says is going to drive his
Her
wife
away.
away.
Yeah, exactly. And I tell him it's our job, our job, not just his, our job, to try to help him understand and ultimately come to grips with whatever's going on inside that's hurting him. It's hurting him. He is threatening this relationship that he wants to maintain. So there's something going on inside that that we need to come to grips with. And listening, well, what is it? Well, I can't read minds. I can't look into your eyes and tell you. I don't know. But through our work together, we'll understand, and we can make that conflict, resolve that conflict, so that he can have the kind of life that he wants.
So we're maybe then going to help him wonder about this confusing thing that's going on with his behavior. That on the one hand, he wants to preserve the relationship with his wife, and on the other hand, he's doing something just the opposite. And what does he make of that?
Yeah, exactly.
Right?
I asked that question.
Yeah.
What do you make of this kind of contradiction that we have going on
So
here?
that's your primary intervention with him, right? Is to say, what do you make of that?
Yeah.
Right? You want him to help him think about it.
Right. I want
Yeah.
to address that issue with that person so
Yeah.
that that person understands that there's something going on inside that doesn't make much sense, that's causing him grief in the long run and in the short run. And it becomes our job together to try to come to grips with whatever this conflict is and then resolve it.
Yeah, there's more to this
That
than
meets
just,
the eye,
right.
so to speak.
Yeah, well, he might identify with that saying, right? That
Yeah.
person.
Yeah.
Yeah, because, or he may not. I mean, I'm just.
You know,
kidding
just like
around.
with the person who says you're like a hooker, well, I'm paying for care. You know, I've gotten to a point where I say to the person sometimes, flat out, you don't have enough money to pay for my care. I don't care how much money you have, you don't have enough. Don't have enough. You know, I could not sit here and work with you and work with other people during the day if I didn't care about people. You can't buy my care. That's not for sale. That's inherent to what I'm doing. Now, you may have trouble with that, and you may want to dismiss that. What does it say about you? What you are paying for is, again, you know, my years of experience and training. That's what you're paying the money for. The fact I do this for a living, does that mean I don't care about people? And I really put it to him just that bluntly sometimes. What does it say about, and then I bring up the whole issue about that, you know, the joke with Marx, the Marx Brothers joke about, you know, I couldn't possibly care because that's, you know, what does it say about you? That I couldn't possibly care. I mean, who knows me better, you or me? You don't just met me. How do you know I don't care? You won't belong to any club that would have you as a member. That's the joke. And of course, once you confront that issue, you have a starting place. You have a starting place. And again, does it always work? Of course not. No. But if you don't engage that person in at least some kind of a question about, how can I say that? He doesn't, this person, I don't even know this person. I'm saying that like they're a hooker, that they're paying. How can I say, I mean, some kind of reflection and how that might affect his relationship with other people. Unless you engage them with that kind of reflection, they're not going to stay. They'll be gone.
Right. They might stay for another session
Maybe.
or two. And
Maybe.
Maybe because
Maybe.
the wife wants them to be.
Yeah.
And then they'll. Yeah, so.
They'll be gone.
We're just picking on it, the fact that this is a man and his wife is forcing him. But
Right.
it could be a woman who's.
Could be a woman.
Husband who's also finding out the same thing about
Yeah.
his wife.
Right. She's drinking, or she's having an affair, you know, whatever.
Yeah.
You know, doesn't matter.
So
You know?
it's so common with the relationships.
Sure.
That they let their partner know. That's another part of maybe want to investigate. But he tells her. Some people were coming into treatment, and you might ask them, "Well, how did your wife know?" "Oh, well, my computer was open on the."
Right.
What's that all about, right? Or,
Yeah.
yeah, or my email, and they saw that I had some encounter with somebody, and then my credit card.
I left the bill in my pocket.
Yeah.
Yesterday, take the jacket to the cleaner, and there she is with the motel bill, or the bill to the club where I was partying.
Funniest ways people have of letting, in a passive aggressive, if you want to call it that way, letting the other person know that they're dissatisfied in some way or another too,
Sure.
with the relationship. Yeah.
Often it's with, you know, I got this text message while I left my phone on the table, and I got this text message, "Hi, honey." Honey? Who is this woman who's calling you honey? Great to see you, can't wait to see you again. What is this? Well, how come the question in my mind is, knowing what you've been doing, you left your phone on the table face up where anybody could pick it up and take a look at it. What's going on here?
What if somebody came in, what if somebody, this is like an off tangential, but if somebody came in and the wife or the husband saw a text message and it said something like, I don't know, not no necessarily honey, but, oh, who's this woman? Or, oh, who's this girl?
It depends how the husband deals with it.
Right.
And if it's the first time or not.
Right.
You know, she might accept it as a mistake if he lied. But if it happens a couple of times, you get suspicious.
Yes, a couple of times. I mean, for the first time, the husband or wife could say, "Well, oh, what makes you ask me that question?"
Because look at the message here.
No, you only got one message.
Yeah, but that's okay. It's a message.
What? That we're going to go out and have a drink
Maybe,
with a woman, man. So that
Maybe.
people have friends, right?
but it's great seeing you. Love to see you again.
Oh, that's a little different.
Well, what some kind of message would
Yeah,
suggest?
Suggest something.
Yeah, I mean, what is this?
So many husbands or wives can get, or girlfriends or whatever can get very, very suspicious of any message if there's if there's any history, and that sparks of trouble between them because there's probably an underlying sense of distrust to begin
Yeah,
with.
nowadays it gets into all kinds of trouble, meaning that they will, the other person will then start to review, want to see their email accounts, they'll want to go over their text messages.
It can be pretty ugly.
Yes, it gets
Yeah,
very
for
ugly.
both of
I want to
them,
go. I want to sneak in your wallet to see what.
Yeah.
I mean, it gets really ugly, intrusive, and it undermines relationships.
Yeah. So if you have that kind of example where a woman walks in and she's forced to be in therapy because her husband found all these text messages. Yeah.
It's the same principle.
Same principle.
Same principle.
Right.
You know, they're being coerced to be there, but they have to understand there's something going. If they want to maintain this relationship with their husband,
So you move.
if they don't, then why are they here at all?
So you move in the same direction, trying to help them in some way come to see.
It's
that-
right. I'm
Right.
sorry to interrupt.
You can interrupt me. That's all right.
The
I don't-
internal conflict.
Yes.
There's an internal conflict,
Right.
and that's what we need to come to grips with.
Right.
Something that is undermining what they say they want. They're unhappy in their relationship, but they're not dealing with it in a way that is productive or fruitful. It's hurting them. It's hurting their relationship. Maybe hurting their children. And our job is to help them come to this terms with whatever is going on inside, to find a better way to deal with whatever struggle is happening, is going on inside.
So on that note, we are going to conclude and return to this. Do you think there's a lot more to say about this?
Well, if people are interested in us discussing more of it, we certainly can.
Yeah.
But I just wanted to make the point about sometimes, that our experience and our work doesn't quite fit the picture of us sitting back there going,
Right.
Mhm.
Many people think about that.
or tell me more about it, and saying very little. Sometimes, we are put in the position where we have to fight, and I'm literally saying this, we have to fight to help the person help themselves. We stand up for that person. Nobody else has ever done that,
Right.
but we stand up for that person by trying to help them engage in a process that we know can help them come to terms with whatever unconscious conflict is going on inside.
Yeah, and sometimes, as I was thinking about this example, which has been mentioned, this is time. I'm going to take the other side too of how hard it is to be with somebody, and we don't do any of this pursuing, but they have a resistance. With that example of Marie Lucas.
Right, you have to know sometimes. Sometimes you just have to know from your experience when to engage and when not to engage in the way we're talking about now.
Right, so that's the opposite example of where Marie Lucas, this person sat behind the couch and didn't say a word for 2 or 3 years.
Yeah.
And that's what she needed. But, who would think that that's therapy? And what therapist would be able to tolerate that situation. Not too many. So that's the other side. I'm just taking the other side
Yeah.
too. There's that side too that is very hard work, but it doesn't seem to be hard work, you know, to the observer. So we're going to part company for now, and this is a 70-second talk on So What Stops You, the continuation of the episode number 8 on Therapy for the Heart podcast. So we're going to think about returning to this subject if we want to or not, right?
Yeah, sure.
And if you have anybody who thinks it's, press the like button on the computer when you see this. So you can press the button and say whether you like the video or not. And Dr. Donald Mars, by the way, if you feel like there's somebody, either somebody you know or yourself maybe has the same kind of persistent resistance or difficulty in engaging in therapy, maybe you want to give him a call. So his number is 212-682-7568 or drdonaldmars.com. And of course, you know, my number is my marksehl.com or marksehl@gmail.com. So anyway, it's nice to be here again, and we'll see you soon. Either we continue with this or not.
Thank you.
All right, bye-bye.